When college student Nick Burriel was nearly beaten to death outside of a Fresno restaurant in 2013, he was miraculously revived by first responders, but left with a severe brain injury. He couldn't walk or talk, but today the 32-year-old man runs races and does public speaking. And he credits his success in part to the speech-language pathologists at the Leon S. Peters Rehabilitation Center at Community Regional Medical Center. Nick Burriel and his family treasure every day together as a gift because life was nearly taken away 8 years ago.
I was assaulted, and my assault caused me to flatline for 25 minutes. And grace to God, I pulled through it.
It's still difficult for Nick's father, Dominic, to speak about that night.
It's been a long time. He went to cardiac arrest and died there that night. And they said he had died for 25 minutes. And that's what happened, is that he lost oxygen to his brain. And that's what caused, the anoxic brain injury that he has now.
Nick was in a coma and then transferred to the intensive care unit at Community Regional. The former collegiate soccer player was left with a traumatic brain injury, unable to do day-to-day things.
I was 100% disabled. I need help with cleaning myself, showering myself, feeding myself. All aspects of life, dressing myself.
But he was driven to beat the odds. Nick worked aggressively with physical therapists and speech-language pathologists at the Leon S. Peters Rehabilitation Center.
Oftentimes we'll see patients right after they've been extubated. And so one of our first things that we'll work with is we work on swallowing, so getting them eating and drinking safely after being both intubated and having had a head injury. Those can both cause dysphagia, which is our term for not being able to swallow or having difficulty swallowing.
Courtney Young is a speech-language pathologist who provides therapy for patients like Nick when they are in the trauma center or ICU.
We also work a lot with cognition and how a patient remembers things, pays attention, comes up with language, understands things, gets the words out, organizes their thoughts, problem solving, things like that.
Dominic recalls the exercises his son practiced with his therapists.
How the miracle of the therapist and the time, the effort they put into, getting him to do exercises with his tongue, even, to lift his tongue to the top of his mouth and drop it, and from side to side. I remember one, they did a spoon where they put the spoon, they wanted him to lift the spoon to generate that muscle memory in his mouth, to speak.
All my PT therapists, a cognitive therapist, all of my therapists I had from all my recovery, they preached to me just keep going on. They always help me out the most.
Today, Nick is training for his first 10K, and he's a public speaker. He was just honored with the Consumer of the Year Award from the California Speech Language Hearing Association State Honors Committee, and will be speaking about his recovery at the American Trauma Society's National Conference. He also encourages youth and other trauma survivors to persevere through challenges he says he couldn't have overcome without his dedicated therapists.
Without them, I wouldn't be here talking to you. Without their precision, without their love of their job.